Well, we want to reach a fair and reasonable settlement with junior doctors. We recognise the hugely important role that they play within the NHS. That's why we stand ready to have meaningful and constructive talks with them, as we have had with other health unions, as we have in terms of responding at the budget to concerns from doctors regarding their pensions. So we are ready to have discussions with them, but clearly a demand for 35%, over £20,000 for some junior doctors is not fair or reasonable, and that is why we've not been able to make progress so far. But we want to engage constructively. We recognise junior doctors have been under significant pressure, particularly from the pandemic, and we want to work with them to find a fair and reasonable settlement. Well, a huge amount of effort is going in to mitigate the impact of the strikes, to ensure that emergency cover is there. The clear message to the public is for those who need the NHS will be there in terms of responding to urgent calls, but to be mindful of the demands that they place on the NHS. But a huge amount of effort has gone into the contingency planning, the measures in place given the effects of the strikes, but clearly they've been timed to have an impact on patients, and I think that's very regrettable.